Hi, I'm Dr. David Klein with Stages of Life Medical Institute. We're going to have a little briefing right now on something called anti-inflammatories and how they may or may not help you with the COVID infection. More so is how they may or may not help you with other sorts of respiratory issues as well. Now with COVID, some people get sick, some people get real sick, and some people don't get sick at all. But what is it that kills with COVID? And it's something called pneumonia. So when you end up with bronchitis, which is the first thing that happens, that's the cough, okay? You're clearing your throat. Trachea, the bronchi. So bronchi is what get infected or inflamed first. When things go south, the inflammation works its way down to the bronchioles, and then you end up with something called bronchiolitis, and then pneumonitis, that's inflammation of the lung tissue, and then pneumonia, which is something called consolidation of the lungs. They get hard, very much like liver. So if you've ever opened up a chicken and you end up with a gizzard, those of you that still know how to cook, the liver is solid, whereas the lungs are spongy. Okay, this is a very, very important difference. When the lungs turn more like liver, you're dead. So what is it that causes this? Why do some people get sicker, and then die? And it has to do with the inflammatory response. So the anti-inflammatories of certain nature may be more beneficial than others to keep you from getting really, really sick. But there's a downside to everything. So what's the downside to the anti-inflammatories? And we all know what they are. You know, my favorite happens to be one called naproxen. You may know it as Aleve, which is the lower dosage, the lower milligram dosage. Works beautifully. Best thing for headaches because it crosses the blood-brain barrier. But it also works for most types of inflammation. But it puts you at increased risk sometimes, in some persons, for heart attack. So you don't necessarily want to do this without either consulting your physician or understanding what the risks are. Risks of a cardiac event are very, very small. The risk of dying of pneumonia might be 1%. So for my money, if I got sick, I'd be taking the naproxen in my case, or Aleve in your case. I do, in fact, take the naproxen every day because of my arthritis. So wouldn't you know, I breathe a little easier as a result. There are your risks. What are the benefits? Again, it will reduce your risk of developing pneumonia, which is preceded by pneumonitis, which is preceded by bronchiolitis, which is preceded by bronchitis. Perfect way to do this. It's inexpensive. It's something that you can actually have sent over by Amazon courier. You don't need me to do this. What are the other anti-inflammatories that may be beneficial to you? Number one is curcumin, turmeric. Turmeric, turmeric. It's a spice. Now, turmeric is interesting. It works differently than your typical NSAIDs. We all know what those are. Okay, you know, from meloxicam to Toradol and straight on down the line. There are many anti-inflammatories called NSAIDs. But turmeric hits a different mediator of inflammation called leukotrienes. So it's a wickedly cool thing for you to be taking. All right, so how much turmeric do you want to take? And the answer is between 500 and 600 milligrams of the standardized turmeric twice a day. Very interesting, very important thing to be doing. What are the downsides to it? Well, the downside, the main one, is that it reduces your risk of breast cancer. The other downside is it reduces your risk of pancreatic cancer. The other downside is it reduces your risk of colon cancer. So it really doesn't sound like there are too many risks involved. Do not put the capsules in your pocket because they will stain. That is probably the only risk of turmeric. So what else can you be taking as an anti-inflammatory that you might find to be beneficial? Another one's called MSM, which stands for methylsulfonylmethane. Dosage there is 1,000 milligrams twice a day. Now, with regards to anti-inflammatories in COVID, we're not really supposed to do COVID-19 testing on people that don't have fevers. So the anti-inflammatories can reduce a fever in somebody that is, in medical jargon, febrile. So understand that if you're going to go stand in line to get tested, and I'm not sure it's necessarily a good idea, okay? If you'd listened to my previous discussions, you'd understand why. Then I wouldn't take this within 4 or 5 hours of being subjected to somebody with a temperature probe in a line expecting you to get tested because they're going to kick you out. The other thing that's kind of interesting about temperature is that temperature tends to decrease with age. That's kind of a weird thing, isn't it? All right, so as your metabolism goes down, your temperature tends to become less numerically. So old folks, funny thing, okay, is that they may not throw fevers the way a baby does. A baby can throw a fever of 104 in a heartbeat. They cut teeth and they'll have a fever. But as you get older, as spoken by Hippocrates 2,500 years ago, the organs of the aged cry out not in pain. You will not throw fever the way everybody else does. So be aware. There's some things that we're going to be able to do diagnostically to help you through this as the weeks go on. Folks that are hypothyroid, and you know who you are. Low temperature is the way you live. So if you have a temperature that typically runs in the 97s, having a fever would be 99. And the folks with the COVID testing don't know this and don't care. If it's not 100.1 or if it's not 99.6, they're going to throw you out. So this is Dr. David Klein, Stages of Life Medical Institute, Longwood, Florida. Thank you.